Hi team, welcome back. If you're applying to medical school or dental schools in the UK, you know that the NHS is in constant evolution. One of the biggest changes right now isn't like in surgery or drugs, it's actually in technology. We're talking about digital transformation and its reality that you'll be stepping into as a future clinician. Understanding this topic is critical for you. It will show admissions tutors, interviewers, that you have a solid grasp of what it's like to be in the NHS, the future direction of travel, and how you fit in as a future clinician into the system. So what is digital transformation? Well, digital transformation is the integration of advanced digital technologies into all areas of healthcare, fundamentally changing how services are delivered, how they are managed, and how they are experienced by people. It's not just replacing paper, like with something technological like a computer or a pad. It's about re-engineering the entire system so that it is smarter, it is faster, and hopefully more patient-focused. In the UK, this transformation is being guided by the NHS long-term plan, and it aims to make the NHS a world leader in digital healthcare. Let's look at 3 key areas where digital transformation is already having a huge impact. The first thing I want to talk about is the digital front door, i.e. patient access. The most visible change is how patients are accessing care now. First of all, let's look at the NHS app. This is the NHS's central digital hub. Patients can use it to book GP appointments, order repeat prescriptions, view their medical records, and get advice. For you, this means fewer administrative tasks and more engaged patients. The plan is to kind of enlarge the ability of what the NHS app can do, i.e. not only GPs, but to access hospital appointments, access dental appointments, optometry, audiology, and so forth. Now, with the digital front door, you also need to think about telemedicine. Telemedicine kind of got fed with steroids, if you like, during the COVID-19 pandemic. That's when we saw a mushrooming of virtual consultations, both telephone and video. And it's now routine practice to see this in general practice in the UK. And increasingly, it is being used by other specialists in secondary care and dental practice. This is felt to improve access for patients, especially those in, say, rural areas, those that have mobility issues, those that want to access healthcare from a distance or from workplace and so forth. The second area I want you to think about is data and records, right? And here, it's important to recognize the biggest technical hurdle we have is linking patient information across different providers, your GP, hospital, dentist, social care, etc., etc. So we have what we call the electronic patient record. The goal is to move every NHS trust from paper to fully digitized records. This ensures that whether a patient is in a GP surgery, is in a dental surgery, in the hospital, A&E, or seeing a specialist person in their outpatient clinic, that clinician has immediate, comprehensive access to their medical history, allergy information, safety information, medications, and so forth. It is thought to improve interoperability. And that means that currently we have a phenomenon of different IT systems everywhere. Hopefully these systems can be amalgamated or be tuned so that they talk to one another, all right? i.e. the ones used in GP practice and the ones used in hospital, they are working incognito, right? Together with each other, as opposed to having firewalls and struggling to talk and pass information, okay? And data sharing here is key, all right? i.e. being able to access that data by different healthcare professionals in different settings. The third thing I want to mention here is advanced tools, i.e. AI and diagnostics. And this is quite exciting actually for future of clinicians. We're already seeing AI in imaging, algorithms, they're now assisting radiologists and pathologists by quickly analysing X-rays, CTs, biopsies, and often identifying subtle but important patterns that indicate disease like cancer, retinopathy, and so forth. And quite often they're faster than the human eye can do alone. In dentistry, we see digital dentistry, and this is important for dental students, i.e., 3D printing for prosthetics, aligners, intraoral scanners, and they're replacing your traditional messy molds, all right? And of course, you got digital treatment planning that it will allow for much greater precision-based work in orthodontics and surgery. So what are the benefits and challenges? All right, and this is where you need to shine in your interviews. For your application, you must show that you're understanding it from all perspectives, the benefits and the ethical challenges. So let's recap the benefits. So the benefits can be kind of summarized into three key areas. Number one, efficiency, i.e. automation of paperwork, use of digital records, freeing up time, resources, and focusing more on patient interaction. You've got safety, which is reducing prescribing errors, instant access to important things like allergy lists, and improved patient safety. And the third thing would be personalization, i.e. AI and big data, it can help identify patients, the patterns and risks associated, leading to more tailored, preventative healthcare solutions for different people, different population groups. Of course, think about the challenges to balance your arguments. There's, of course, the thing to think about, which is the digital divide, i.e. not everyone has a smartphone. Not everyone has reliable internet access. Not everyone has got the right digital skills to use new tools, new apps, new software. So we must ensure that digital transformation doesn't exclude the vulnerable, the elderly, the refugees, and the other population groups that might struggle. There's also, of course, you might have heard about data security and privacy, right? And we've already had problems like this. Handling vast amounts of sensitive patient data requires robust cybersecurity and ethical governance. The NHS is a frequent target, so security must be at the highest level to protect that data from being stolen, from fraud, from duplication, from commercial interests. And the third thing I want to mention is clinical burnout, i.e. digital systems, they need to be well designed. They need to be intuitive so that poorly implemented electronic records don't then slow down staff and the work, increase frustration, and hopefully not become a threat to the well-being of staff and patients. As a future doctor or dentist, you won't just be using these tools, you'll be helping to shape them. Medical schools and dental schools are looking for candidates who are technologically curious, i.e. you understand how AI and technology can impact diagnosis and future care. They want people who are ethically grounded, i.e. you can balance the convenience of digital access with the need for digital inclusion, data privacy, and so forth. And I guess they want to see a change agent in you, i.e. someone who's ready to lead their team, adopt new, smarter ways of working and delivering healthcare. Whether we like it or not, digital transformation is the future of UK healthcare, and it's full of challenges, no doubt, but even more opportunities, we hope. By showing a deep, nuanced understanding of this topic, you will demonstrate that you're ready to be a leader in the next generation of clinicians. I hope you found this video useful. Please like and subscribe. Watch other videos on our platform, on our website, and I hope it benefits you. All the very best for your future.